Hello, everybody. Good afternoon and welcome. My name is Tamsin Rose and I'm the Senior Fellow for Health at the Africa-Europe Foundation. Welcome to the latest in our series of Talking Africa-Europe activities, our monthly live broadcasts from our studio in Brussels with a strategic focus on putting the nexus of addressing the next climate crisis and building resilient health systems at the heart of a strengthened Africa-Europe partnership. Today, our event, I'm delighted to say, is the launch of our high-level group's report, and I'll tell you more about that, but we are launching it in collaboration with the World Health Summit, which has been held in Berlin this week, where global leaders have been exploring just this point. How do we address both the impact and aftermath of COVID-19? How do we make sure that the future is better, is more balanced, that we can achieve better results than we have over the last 18 months. And that's certainly something we're going to pick up on through the Africa-Europe Foundation, because we're interested in developing a new, more vibrant, more equal, more sustainable partnership to see what the two continents can achieve together. Just to let you know, the 2021 series of Talking Africa-Europe Dialogue bring together a range of different stakeholders. So you will see today and in future events a mixture of policymakers, city mayors, youth representatives, EU and AU commissioners, as well as civil society and business leaders, all coming together to create a new conversation. This report is a landmark opportunity for the Africa-Europe Foundation to shape the future agenda between Africa and Europe, particularly around the issues of health and climate. And I apologize if we're having some sound issues. We'll try and fix that for you. I understand the sound is not very clear. That will come through to you. But what we want to say is now is a really critical moment. For almost the last 2 years, the world has been trying to tackle COVID-19, and the pandemic is far from over. It continues. Infections are still growing. More than 500,000 people have died in Europe alone. Globally, several million. And over 100 million have been infected. And that's just the numbers that we know of. So this pandemic was a very sharp mirror to show us the extent to which our systems of epidemiology, of health, of solidarity are or are not working. And in the next 10 days at COP26 in Glasgow, the world will have another opportunity, perhaps an opportunity to do better in terms of more equal relationship, in terms of solidarity, in terms of action taken together for a better future for all. So in that window of time between recognizing the failures of what didn't get delivered through the pandemic and the decisions we need to make in the next few weeks to make our climate livable and manageable for the future of humanity and the planet, this is the time that we meet, where we need to find a way for our two continents to find a way forward. This report, and here I'd like to just show you, this is a report that we have just launched. We'll be publishing it on our website, and I apologize if you haven't been able to hear me. We are trying to fix whatever the problems are with the sound, and I will get back to that. In the meantime, you can see the hashtags behind me, Talking Africa Europe, WHS 2021. Excellent, I understand the sound is back. Thank you, everyone. So let me remind you again what we're here for. This is the launch of the annual report of the high-level group of personalities of the Africa-Europe Foundation. And our focus this year is pandemic preparedness and the future of healthcare. It's become clear that we have failed as a global community to respond to the challenge of COVID-19. To be fair, the virus was something that has responded faster than we've been able to, even though it has never in the history of medical science been able to have a new pathogen emerge, to have identified, diagnosed, a vaccine and possible treatments, all in less than 18 months. So we have attempted to respond, but the virus has mutated faster than that. We have not been able to get the vaccines out to the people that need it around the world. We failed in our commitments to deliver vaccines equitably. And as I said, in the next 2 weeks, the world has another opportunity to identify and make the case for global solidarity at COP26, where another existential challenge to the world is being faced, climate change, where again, we need coordination, collaboration, political leadership, financial investment, and a shared effort to meet everyone's goals. So in that window of time between reflecting how far we've come in COVID-19 and what still needs to happen, and the big political decisions to be taken in COP26, we find ourselves with the report of this that we've just launching today. And we're doing it with great pleasure in collaboration with the World Health Summit in Berlin, which this week hosted global leaders, including Dr. Tedros from the WHO, the President of the European Commission and the European Council, all discussing how to make sure that health and global health is a more balanced approach in the future. So that's enough from me. Let me invite, we have a few speakers who will kick us off, and then you are the stars of this conversation, because this is very much, when we say it's a Talking Africa-Europe debating series, we really mean it. So please, to engage, you need to put your questions or your comments in the chat. And if you could put your name and organization, that would help us. And after we have a few kickoff speakers, I'll be opening the floor to you. So it gives me great pleasure to pass the floor to our first person, that's Zeinab Badawi, who is a member of the Africa-Europe Foundation's high-level group of personalities, in whose name this new report has just been issued, which you'll be able to download and share. She's also president of SOAS, an international broadcaster, and a member of the board of the Mo Ibrahim Foundation. Zeinab, the foundation was launched with the idea that we desperately need a new conversation. We need a new narrative and a new relationship that acknowledges the complexities and the challenges of the past. It doesn't shy away from controversies, but seeks for a way forward to see where there is mutual benefit. This is critically important, both for the climate issues and health issues. So let me invite you to give your reflections on the state of the relationship and the narrative between the two continents. Zeinab.
Thank you so much indeed, Tamsin, and hello to everybody. Lovely to be with you. I'm very happy to be speaking at the launch of this annual report of the high-level group on pandemic preparedness and the future of healthcare, which I've read. I just actually, I'm going to keep my observations focused on the report, highlighting some important aspects. And my reflections on the report, by the way, are very much the culmination of many decades spent traveling and reporting around Africa and Europe, and being involved in development organizations such as the Overseas Development Institute decades ago, and talking to governments and policymakers, citizens, and crucially, health professionals and scientists in both Africa and Europe, and of course, as a member of the high-level group. It's an excellent report that's been put together, and it really sets out the opportunities that the Africa-Europe Foundation can play in shaping the agenda, in recasting the narrative of what Africa-Europe relations are and what can be achieved in recognizing the interdependence between the two, and also the nexus between climate and health, and examining what the potential is for collaboration to build resilient health systems. Just at the outset, recasting the narrative. Yes, people talk about a more equal relationship, and I know, Tamsin, that's what you've been talking about, but actually I wouldn't argue for equality. I would actually argue for Africans to have a greater share in the say of what happens to their people and their continent. So actually it's not a 50-50 partnership. I think the Africans should be in the driving seat and have a greater say. At the moment, you're right, we don't even have equality, but I'd actually like to see it as a relationship where the Africans really have a bigger voice. First, let me just look at the health and climate nexus that the report sets out, and just very quickly starting with something which is very important for women in Africa, of course. Endorsing a declaration on clean cooking solutions is very important, because we know that a lack of clean cooking fuel means that more than 1.5 million African women die from illnesses related to dirty cooking fuels. Also, air pollution is very bad for health, and as populations in Africa become more urbanized and cities grow, this is going to be an increasing problem that will need attention. But one aspect of climate change and its interaction with health that perhaps hasn't been highlighted as much as I would have liked is the issue of water. We know that we're going to have to adapt to changing climate. You know, you can't make it rain. And we are seeing that arid and semi-arid areas are getting drier. And then sprinkle on top of that increased flooding. And, you know, we either get too much or too little water, not only in Africa, but all over the world. And we know that current projections say that by 2050, 5 times more land will be under dry conditions. So water scarcity will increase. And a lack of clean water is a big issue for health. And so water is a huge health issue. You know, we know that 85% of drinking water comes from groundwater. And in Africa, you know, I see my well-off relatives buying tankers for their water or drilling their own borehole to get water. But poorer people don't have these secondary water sources. So they use dirty water, even when they can get it. So I would like water and sanitation to be included in this health report and to raise the alarm on that. Because we know that many of the world's most serious diseases and main causes of child mortality are related directly to poor sanitation and hygiene, which is the result of a lack of clean water. And there has been considerable and consistently chronic underinvestment in this sector for many, many years. And if we carry on this current trajectory, SDG 6, which is on access to water and sanitation, will not be achieved until 2070. So, and climate change is a big factor in water scarcity, but also a lack of a will to act, poor management of water resources, as well as pollution, especially by industry. So we need a kind of, you know, collective voice to say we need to do more about water when it comes to health. And we don't need water just for people, but also for animals and also for washing, obviously, but it's also essential for food production because actually the vast majority of groundwater supplies goes into agriculture. So let's have a little bit more of water in the health report. Next, quickly turning to pandemic preparedness and building robust health systems. We know a top-level inquiry this week has concluded that the world is woefully unprepared for any health emergency. We've seen vaccine hoarding, oxygen shortages in low-income countries. Situation is very, very fragile and urgent in Africa. The report rightly says, African governments, you need to do something. Reiterate, do something about your commitments to spend 15% of your budget on health to meet universal health coverage. That's not happening. I would also add that African governments have also said that they are going to spend 2% of their GDP on scientific research. That's also not happening. So we need to know why the Africans are not doing their part on that. Health personnel, we've talked about that in this forum. Very important to have increasing mobility of Africans, health force within Africa itself, and also to set up some kind of workforce observatory to ensure that the brain drain is addressed in some way. Perhaps there's some kind of recompense, which is what I would like to see. Yes, talk about the power of technology and digital revolution in health. That's another thing the report highlights, which is very important. But I would just say, let's not fall into a techno-chauvinism and pretend that there's some kind of digital utopia and forget that actually human beings, you know, the touch of a nurse or a doctor staring you in the eye is also very important. It's not all about AI. I want to say something about science because the EU role in helping to support R&D on the continent of Africa is very, very important. I've spoken to my friend, Professor Christian Happy, Cameroonian-born scientist, one of the world's best scientists. He's just left Harvard recently to set up an early warning system for infectious diseases in Nigeria. And, you know, he has said to me that, you know, we need to support African scientists doing research on the continent itself. The report does say that the EU needs to support the 3 Million African Genomes Project. Good start. So important. People don't realize that African genomes are the oldest and most diverse. We can learn a lot about infectious diseases from that diversity in a way that will benefit all of us. We can get breakthroughs in gene-based therapies to cure cancer and lots of other things. And only 2% of the analyzed human genome is African. That needs to improve. Again, Africans being left out of this picture. Africa is 16% of the global population, but it is where 70% of pathogens with pandemic potential emerge. So Africa could actually become a global center of knowledge about infectious diseases such as COVID. And I think that, this realization that we have some brilliant scientists working on the continent, but the money does not find them. And even where Europeans do offer support in the form of grants or collaborations, you drill beneath and look at the funding mechanisms, and you actually see that a lot of the research is still European-led and the money does not end up in Africa. And then just finally, we've talked about vaccines a great deal. We know that COVID, 0.1% of vaccine production facilities globally are in Africa. This report supports vaccine hubs in Africa, very important to get the technology transfer and so on. But I just want to say, of course, we need to help Africa meet 60% of its routine vaccines by 2040. But I do just want to say that the report calls on solidarity and for European nations to do more to deploy all unused vaccines into COVAX. But it's not worked, has it? I mean, the vaccines are not being distributed to Africa. COVAX scheme is not getting enough. So I'm wondering aloud if we need some kind of structural change and a different model if we are to avoid this in future. Because despite the calls for solidarity, European nations are protecting their own because there are no votes in Africa for European political leaders. And then my final thought that I wanted to give you is that health and climate are inextricably linked, but also so many other issues are. 30 years ago, I was in Uganda. I saw a young man clutching a bag of antiretrovirals. He was obviously HIV positive. Great, he'd been given these drugs by the international community. But I saw him walking in a dirty slum, going back to a really horrible dark hut. Like he passed by an elderly man who was washing a piece of pineapple he'd found on the ground, washing it in a dirty, polluted water channel. And I thought, well, he may survive HIV, but he's going to die of something else. So in the same way, giving people a vaccine is not enough. We've got to look at all the issues that determine health, the social determinants of health, good shelter, good, decent jobs, access to energy, all the rest of it. We cannot just look at health issues through the lens of ministries of health. You have to have a holistic approach. And so in this way, I think that Africa, could be better prepared for the pandemics of the present and the future, and also build more resilient health systems if we do just acknowledge that we can't tackle this Sustainable Development Goal on health without tackling all the others. They rise and fall together. And I think that would be my main message from this report and to the summit next year and so on, is that you've got to do it all together. You can't succeed if you don't. So thank you. I may have run over my time, but thank you very much for your attention.
Thank you very much, Zeinab. I think that was very helpful for us to put both the current issues in the context and also to make the case that everyone needs to step up. There have been failures across the board, not just at the time of COVID, but failures to meet commitments, to invest in what's needed and to play a role. And you've given us a clarion call to reflect on better governance and better decision making. And on that issue, I'd like to bring in our next speaker, and that's Gunilla Carlsson, who I have great pleasure to introduce because she's the co-chair of the Health Strategy Group that I enjoy supporting. She's also a member of the high-level group and has a number of other positions on global health. Gunilla, I wonder if you could give us a few reflections about where we are, the current state of global health governance, and where are the opportunities for cooperation for the Africa-Europe partnership to do better? Because I think everyone agrees that whatever we had and however extraordinary the efforts have been to put something together, it hasn't delivered the impact and the outcomes that we need and we hoped for. So where are we in the global health governance environment?
Thank you so much, Tamsin, and hello, everyone. I will try to address your questions, but I would like to start around health and well-being, because this is nothing you think about until you don't have it. Then it takes all your energy and wishes, because without health, no well-being. And consequences are, of course, worse for those that do have nothing, lacking health systems and health security, and as well as lacking clean water, sanitation, and healthy nutrition, as Zeinab said, and we could add job opportunities to that. So it's complex, and I'm starting with the individual, as I think we cannot build systems without including the people concerned. And this is a global as well as a very local challenge. If we are to make fundamental changes, we must recognize the power and capacities with those that are concerned. And now we are in a time where we have learned a lot from the ongoing COVID crisis. It is far from over, and it has hurt the most vulnerable most. I'm so sad to see the current figures in HIV, malaria, and even worse so in tuberculosis. The gaps are widening towards our 2030 goals, as well as a growing number of people risk falling back into extreme poverty. Pandemic preparedness, addressing barriers to health, and the need to do far more on prevention in all its aspects, including financing, regulations, and calculations, will be fundamental when building better governance around health. And as we do in this report, we must link people's health to the health of our planet. I read the independent panel on pandemic preparedness and response report, and they give us a good observations on early detection, better trust in data, and decentralized capacities to strengthen the chain of early warning, as well as identifying the gaps in global response. I agree, a pandemic treaty could be a good start for a more solid and hopefully reinvigorated global collaboration around health. And when the European Union now is focusing on building back better, there could be a far better interest in the capacity and powers in the growing and youthful population of Africa, with the great opportunities for new thinking, science, and innovations, because we must rethink the way we organize health, rethink the imbalances among those who have and those who don't. The need for global action has been so clear during the global COVID pandemic, and we know that no one is safe until everyone is safe. Africa and Europe cannot waste the opportunity to better work together and strengthen Africa's hand in global health governance. Now is the time for us to spend more efforts in joint rethinking the global governance based in our shared values as equal partners. I support the report's call to scale up financing for African healthcare systems as a whole and investing in specific production capacity for Africa-made vaccines. And I would like to say a few words on this, because we have seen now the global recognition of the need for greater vaccine manufacturing capacity in Africa as an opportunity that cannot be wasted, and scale up this question to look at greater financing for African healthcare systems as a whole, which could lead to manufacturing of many other health commodities, linking to increased research capacity and innovations at scale. The rethink must include looking at new methods of financing developed by multinational financial institutions, including the European Investment Bank and the World Bank, where the African Development Bank will be an excellent vehicle for addressing what can be done. Investing in specific production capacity, African-made vaccines will create numerous positive externalities. Intracontinental trade is one key ingredient, storage facilities and employment opportunities to stand to gain from setting up an African vaccine pipeline. And greater vaccine export capacity strengthens Africa's hand in global health governance as a good start. I would also like to take this opportunity to recognize the impressive speed Africa governance capacity around health has developed, regional as well as Pan-African collaboration, like the African Continental Free Trade Agreement, as well as Africa CDC, to mention two main pillars that speaks to enhanced collaboration between African and European institutions. The EU-Africa summit in early 2022 can be a great reset in the two closest continents' collaboration. And for the Europeans, I only have the advice, do not waste this opportunity. And the only way of developing institutions is to use them. To me, that is the best way to leverage the African capacity into the global context, and the time to accelerate this is now. Tamsin, as we are addressing also climate change in this report, and I'm so proud to be part of the foundation and being part of the health strategy work, I'd like to end on the COP26, as I, in my previous post, spent a lot of time on climate change and development. Back then, EU and Africa were true good partners in this field, and I wish that link could be re-established, as it was so powerful. So unlike me, I will end on a negative side. COP26 is set to be a missed opportunity for Africa and Europe to work together and build common ground and a taxonomy around climate and its implications for health in the context of this strategic milestone and global arena. The failure of leading countries to facilitate greater access to vaccines, including the exclusive efforts undertaken by the UK COP26 presidency, particularly around the rising cost of travel, accommodation, and the limited availability of quarantine hotels, presents a challenge to the success of this conference. That is so sad, as this is one thing that could have been fixed quite easy. We need to include all stakeholders to jointly solve the climate change crisis and create better health and well-being for the people and our planet. Thank you so much.
Thank you very much, Gunilla. And again, ending on that very sober note that we could have made better preparations and planning to make sure that COP26 was accessible and inclusive, so that we heard all the world's communities in the discussion that affects everyone's futures. Just to reiterate that today we are launching our report, which you will soon be able to download, and we'll be releasing it on our website. But just to give you some insight of some of the headline recommendations and elements that we have in the report, I'm delighted to introduce Dr. Wuleta Lemma, who is one of the authors of the report and who's going to give us just a brief touching on some of the key messages and recommendations in the report. Of course, we very much hope the report will be taken and read by decision makers and policy makers. Wuleta, what do we hope they're going to read in our report?
Thank you. Can you hear me?
Yes, you can.
Yes, thank you very much. I will try the previous speaker, Gunilla and Zeinab, have tried to highlight some of the things we try to highlight in this report. But I would like to take you in memory lane. In 2018, the World Health Organization talked about a disease that may come called Disease X. Disease X represents the knowledge that serious international epidemic could cause a pathogen currently unknown to cause human disease. At that time, the WHO recommended that we should prepare our logistic systems, our vaccine systems, everything that we have to prepare to this unknown disease. This is 2018. And at that time, some of the big problems around the world in diseases were like Ebola, MERS, SARS, things like that. Nobody thought, just within a year and about, that we'll have a pandemic. A pandemic at that time we called Disease X, which we didn't prepare, which we didn't listen, which did devastating thing to the world. Today, this morning, I was checking how many COVID cases we had around the world, more than 245 million. We have lost our brothers and sisters, almost 5 million around the world. And around 200,000 have recovered. What is amazing in this 2020 to 2021 is how the world collaborated together, scientists collaborated from different parts of the world to create a vaccine this fast. And a vaccine was created. At the moment, as we speak, 49% of the world population has one dose. Around 6.4 billion doses have been administered globally. But only 3.1% has gone to people in low-income countries. And for Africa, only 4% of African population has been vaccinated. If you think of the doomsday scenario that was when Corona came, that we heard what was going to happen in Africa, even though it didn't happen at that rate, but still African and the World Health System was not ready for this disease X, which in our language and in our, maybe somebody who writes about us in 100 years time will say their time of disease X may be COVID. So this report tried to understand and to bring three questions together. What needs to be done to shift the developmental narrative and recognize interdependency between climate and health? I will explain later on everything we touch, every disease that has affected us in the last half a century or more has something to do with climate and health. And in these unique circumstances, what COVID have taught us is we are not alone. We can't do it alone. So what can Africa and Europe collaborate to build a climate resilient health system? What do we mean by that? And what are the low-hanging fruit that we can all do together? What can we learn from innovative local approaches? There are a lot of innovation going on in different parts of Africa and different parts of Europe. What can we learn? How can we scale them up? And how can that collaboration can create, hopefully, maybe to avoid disease Y that may come in the future. So the report recommends focus on three pillars: a common agenda for global health governance, a holistic approach to health and environment, and building a system for the future. It builds on the high-level group meeting on June 4, where the African Partnership presents to us a unique opportunity to respond to the wake-up call for COVID-19, has given us by acting with urgency and master the necessary resources, political will, so that no health threat ever devastate the planet in the same way. There was also the second African Union, Europe-African ministers that happened the last few days, where if you look at it, they endorsed around 50-something cooperation together, Europe and Africa. Just to highlight a few of them, the ministers welcome youth as drivers of sustainability, inclusion, development, emphasize the importance of active participation of the youth, social, economic empowerment, and adequate exclusive political participation. They also spoke about building a resilient health system. That COVID has taught us we don't stop at COVID. We have to use the experience of COVID to bring more collaboration, more working together, and more innovation so that Africa and Europe can prepare for the next pandemic and also use this pandemic to build a resilient health system. In reality, what does it really mean? So that we don't miss this chance. In my culture, there is a saying that when the iron is hot, that's when you bend it. So there is a lot of global will at the moment. How can we use that to build a resilient health system? So we try to divide the report on finance, manufacturing, supply chain, health and climate development, and digital intelligence and artificial intelligence. On the finance, some of the things were spoken by the previous speakers, but as we speak, for me, as an African, only 1% of the world vaccine is produced in Africa in 2021. So this is unbelievable. What can we do about it? There is a lot of initiatives that are going on by using COVID. How can we build Africa's capacity to produce vaccines? Even the vaccines I was vaccinated maybe 50 years ago, still we don't produce them in Africa. So what can we do? So there are a few things that we suggested. The EU proposal for India and South Africa, backed by the African Union, China, US, and WHO for temporary TRIPS waiver, so that intellectual property can be waived, so that more vaccines can be produced and distributed in Africa and other low-income countries. Just to saying that, recently in the country I'm living in Portugal, 85% of the population is vaccinated, and they don't even know who else to vaccinate. This is the reality and the gap that we have. So by building Africa's capacity to develop vaccines, by building Africa's capacity for pharmaceutical, there are a lot of goodwills that are happening. The African Medical Pharmaceutical Association and medical agency is being founded. So all these things can help to bring some of these issues to light. On health and climate development nexus, everything, like I said, in the last 50, 100 years, if you look at every disease, 20% of the disease has to do with climate. And how can we make sure that we understand what is going on with climate, how it affects us, like Zeinab said, not only humans, it affects also animals, where the food production comes from. How can we make sure that the One Health agenda, where climate, disease, environment, and preparedness preparedness and projection all comes together? How can we make sure that animal diseases and human diseases, we understand them, so that we can make sure that the next pandemic, like COVID, like SARS, like MERS, all of them are associated with animal disease? How can we make? There's a lot of agenda between Europe and Africa to work on this. The green wall, the Great Green Wall, Zeinab mentioned about water. One of the biggest problems in Africa is deforestation, as we all know. There is a lot of initiatives from East, West Africa, North, South, to make sure that to curb deforestation, so that we can build the green wall, so that this may be one way of retaining water in some of our hard to reach area. Rural Resilient Program, Africa in this case, 85% of Africa in many countries is rural. Sometimes we forget the rural. So how does climate change and rural resilience program, where most of our women is, by the way, where cooking and clean cooking and others are very important. So we try to highlight how to make sure that the rural is not left in this discussion. And clean cooking, what Zeinab mentioned, which is very important for renewable energy and other things that we should think about. So saying that, on the last part, we talked about digitization and artificial intelligence. Africa is, and Europe, in the last number of years, a lot of data has been produced. A lot of data has been produced, and on health, on environment, on different education and other things. But we and the population, our patients, our doctors and things like that haven't really benefit from this data to improve our healthcare system. Why? And I work in the healthcare field. I can tell you that there aren't a lot of regulations that make sure of data privacy for African data. Many studies are done in Africa, but there aren't a lot of data protection laws. African Union is working on it. Different countries like South Africa, Kenya, Nigeria, and others are working. Europe has been working on to strengthen the GPRS and other things in Europe. How can we learn together so that we can make sure that data privacy is important? Other legal mechanisms for data are there together from our learning experiences. The other thing we want to talk about is, like I said, there's a lot of data in Africa, and there is a lot of in Europe. There's a lot of learning that we in Africa can learn from how Europe is looking at health data. At the moment, for example, if I'm in Portugal, if I get sick traveling from Portugal to Italy, at the moment, they are working on it, there isn't a way that my data can move with me. My health data can move with me. So Europe is working to make sure that European citizens of 28 countries can build a European health data space. In Africa, if I invite you to some of our hospitals, digitization can change our hospitals amazingly. Go and next time you are in Africa, now in some of our hospitals, go and check where the patient data is. Then you'll understand why digitization is important. And Africa is very young, youth, techno-savvy. I believe we can use their energy to build what Europe is trying to build, to make sure that information, health information within the 28 countries can move. And this is something Africa can aspire. It has something to do about connectivity. It has to do with digital ID, all the things that Africa 2063, which I'll come by, talks about. So how can we make sure that African data can own its own data, can work in partnership with Europe to learn and also to use our information so that we can curb the next diseases, even the diseases that we have now, TB, malaria, NCDs, which are really, really rampant now. 23% of Africa has non-communicable diseases, but we don't have a central place where we have. The other part is the work observatory, the health worker force observatory. By 2030, Europe will need an additional 1.8 million health workforce. Africa around 4.8 million. It's difficult to make that number. And this is without even counting the new skills that we need in both continents, in IT geared to health, IT geared to education, for AI, for data science. And Africa can contribute the youth. We have the youth that can contribute. So it's not like one-way street only. So how can we predict what is needed for the future? This is why. What kind of health workforce does we need in the future? So saying that, in all this, I hope you'll go dig deeper in the report. We try to bring so many issues that will bring our partnership and our collaboration in the spirit of collaboration between the two continents, whether implemented in standalone or in concrete steps together. The high-level group suggested action that can put both Africa and Europe on the road to leaving no one behind by 2030, creating the Africa we want. I'm an African. The Africa 2063 is, for me, the Africa I want, the Africa my children want. And what our leaders have said they want, this is one way of collaborating and building on the African agenda, African owned and African led, in my opinion, to make sure that all of these things that we talk about are shared equally with respect, both continents, but with using the resilience, the knowledge, and the culture both continents share for a number of years. So saying that, I hope I have 1 minute. A friend of mine sent me this, and I leave you with this.
You okay? You need a minute? Cool. Okay. Listen up, people. I know a thing or two about extinction. And let me tell you, and you'd kind of think this would be obvious, going extinct is a bad thing. And driving yourselves extinct? In 70 million years, that's the most ridiculous thing I've ever heard. At least we had an asteroid. What's your excuse?
Like you said, they had an asteroid. What is our excuse? We can collaborate and make sure that the climate and health is very important, and we need to build a resilient health system. Thank you.
Thank you very much, Wuleta, and for reminding us that we need to make sure that life on this planet continues. I'm going to now bring in the audience because we've given you some big picture, we've given you some suggestions and I hope you'll have a chance to download the report and see we've structured it in a way that looks at issues of governance and at financing and at digital. Obviously, lessons learned from the last 18 months, but also a perspective going forward. We've already got some really interesting comments coming up in the chat. There's been a welcome for Zeinab's message about water. We've had somebody who said, really, what's the challenge? Can we be honest about why we are unable to get domestic manufacturing for vaccines effectively happening in Africa? We've had somebody else talking about education. Nina's mentioned there regulatory incentives and mechanisms. For me to bring you in, I need you to please put your hand up, and then we will start a process of bringing people in. I've already got 3 people or even 4 on my list who've put their hands up who are going to speak. Let me invite the first person to speak is Mr. Yekoyesew Belete. We're delighted to have you with us. You are a former Director General of the Ministry of Health of Ethiopia, and we spoke earlier today. You're a Chevening Fellow here on a progress system of learning in Europe. Can I invite you to share some of your perspective from seeing it from a national environment, trying to manage both climate issues and forward planning for your health system? What would you like to share with you? Yes, go ahead.
Inviting me to speak on this platform. I'm a Chevening Fellow for the leadership, and I'm here in Coventry. So climate change and health, as it was spoken by previous speakers, and I'm very much honored to see Dr. Wuleta, who has been working to strengthen the Ethiopian health system, specifically in the digital health system, and she has explained it very well. It is very much interconnected, and Ethiopia, with a population, second most populous country in Africa, where 70% of the population is less than 30 years old, you can imagine the impact of climate change on population as well as related health. And when we see the impact of climate change, we can see the direct impact in Ethiopia of increasing, infectious diseases as well as vector-borne diseases such as malaria. We thought we will be in the road to eradicate malaria by 2025, but here we are now seeing a new surgence of incidents in different countries. There is an indirect effect on our, population health, increasing the internally displaced people, reduced or catastrophic socioeconomic status of our population, which indirectly contributes to the health of a society. So what has been the path so far for Ethiopia? Ethiopia has been the voice for climate change among the pioneers in Africa. In 1992, we have joined the United Nations Framework for Climate Change Council. And in 2015, we were the first country to make a national, nationally determined contribution towards UNFCCC. And nationally, since 2011, we have a climate resilience green economy. And since 2019, I'm sure you have heard in the news that, the Prime Minister is leading a green legacy initiative, which focuses on planting trees of like 4 billion now to 6 billion in 2021. And we have achieved 85% of the target. So we are part of the globe, since we cannot stand climate change as a country alone. And when you see health systems cannot just stand by its own. It has to have a multi-sectoral nature to address the climate change related, health problems. So what do we have in the health? We have a national health adaptation plan to climate change since 2016, and the recent plan was from 2018 to 2020, mainly focusing on climate change adaptation in health, community mobilization, partnership, as well as strategic health system strengthening, focusing on climate change, reduction. And it has 10 interventions. And I would like to invite all the listeners to really go into and see the national health adaptation plan. So what is missing, or what should we focus from the lessons taken so far? The first one is evidence. Yes, we have incorporated the climate change information system into our integrated disease surveillance and response, information system, but using it to take action in, mainstreaming climate change friendly health service delivery is one thing that we are still working on. Second thing is involvement of the private sector. I think COVID has taught us a great lesson of the untapped potential of a private sector in addressing not only health-related issue, but having a resilience system to respond to current and future shocks. The third thing is the workforce development, and I'm glad that Dr. Wuleta has mentioned it. The way how we train our healthcare providers at all levels should have a component of climate change and also addressing impacts on population health. The last but not the least very important one is allocating resources from the domestic as well as from the international community dedicated to public health emergency response and integrated into any kind of aid. So these are my thoughts and the health system strengthening and resilience activity that Ethiopia can share, but also work on the future to achieve its own target of reducing the impacts of climate change by 2030 and moving forward. Thank you so much.
Excellent. Thank you very much for sharing the perspective from Ethiopia and also identifying how a country can set its targets and work towards it, but reminding us that no country can address this alone. It is a global effort that we need. We've got lots of interesting comments coming up in the chat. Several people are echoing the messages that Dr. Wuleta Lemma talked about, the potential of digital transformation, both for health, but also for general development, but then that it needs to be based on dealing with education. There's a lot of infrastructure that needs to happen. Nina's again talked about the value for drug development and diseases that affect the African continent. I'm going to mention a few people who I'm going to invite to bring in, so because they've got their hands up. So Marjus Ceveli, you've got your hand up, and Ossama Salamah, I'm going to invite you to both come in. So Marjus, would you like come in first?
Here I am. To hear me?
Yes, go ahead. Yep.
Okay, thank you. I'm really pleased to be here again. So I'm Marjus Ceveli, Young Mediterranean Voices alumnus and president of Sustainable Cooperation for Peace and Security. I'm joining from Italy. So what I want to say, when it comes to healthcare issues, as we all know, viruses have no borders, but states do. So to face future pandemics, the only solution that we have is to work together, creating global partnerships and push for global policies that can protect the health of all the citizens around the world. I think one way to finance these global partnerships that are working on healthcare issues is to tax the most polluting enterprises. So we need to introduce a global carbon tax, and this can help both the environment and directly the health of the people and the animals.
Okay, thank you very much. A good point that we need to address the sources of some of the pollution and make sure there is a final financial connection between the impact that it has on our biosecurity and our biodiversity, and this is part of our global solution. Ossama, I'd like to bring you in next. I also have Björg Pálsdóttir, who's got her hand up next. So Ossama.
Thank you very much, Ms. Chairman, and our eminent speakers. I'm not very fortunate because I just joined you. This is my first time to join your meetings, but I've been asked by Mr. Sajan Karim, who was the president of the United Nations Assembly, the 62 session, to attend on his behalf, and he extended his apologies for not being on this call. And allow me to thank our eminent speakers as well as the gentlemen and the comments that came on. My name is Ossama Salamah. I'm a doctor by background, and I speak in my capacity as the Chief Executive Officer of Human Health Education and Research Foundation. We are a non-governmental, non-political, not-for-profit organization based in UK. And we've been established at a time of a crisis in July 2020 because of a frustration of a group of leaders like yourself. As of now, we are 100 leaders from almost 40 countries, representing around 48 industries and speaking around 40 languages. We share the same thing that our eminent speakers and attendees are talking about. The lesson we learned from COVID, that there are no borders in disease and health. And we are not safe unless we are all safe. And we've thought about it for a long time, and we come to the same conclusion that you've all mentioned. The only way out of this is to challenge the economical and political borders and start working for the first time as a community. And that's what we name in our foundation WISHES, World Integrated Sustainable Health Ecosystem. We're trying to build this WISHES by bringing multi-sectoral minds, and I do invite all of you to have a look on our website, HHERF.org. The current situation, if we don't look at human health from a comprehensive point of view, and we get all this expertise and work together, there are no way out of these challenges. COVID-19 is just the beginning. And as the video that our speaker shared with us, we had an asteroid. We had the COVID-19 and the pandemic. It's our time. This is the right time that we wake up and we join hands and we start working together as a multi-sectoral, cross-border community. And we look at this as a unity rather as silos. It's the time for harmony. And I want to thank you for this, and hopefully that I'll be joining you in the next meetings as well.
Excellent, thanks a lot. And we see that the link to your organization is the chat. I've got quite a few more people lining up, so could I invite you to be short and concrete in your messaging? Let me invite Björg. Björg, would you like to come in next?
Sure, quickly. I think what's been brought up here about cross-sectoral and context-driven approaches is really key to what we do. Because like Zeinab Badawi talked about, we need all these elements to work together. However, I think another thing I do want to mention, I think COVID has also taught us, whether in high or low income countries, that communities and patients are a part of the health system and they're key partners to ensure that we achieve our health and social objectives. So when we are going to design these better systems, better policies, projects, and other efforts, we need to work with those we are serving, whether it be youth group, we need to work across sector, but also with the communities, particularly those most marginalized, so that we can actually co-create solutions that work, that are implementable.
Excellent. Thank you very much, Björg. And if you share in the chat the link to your organization, people can find out more about the work that you're doing around socially accountable medical training and working with communities and patients to empower them to identify their health needs. We're delighted to have another member of our health strategy group, Eunice Brookman, who's a former ambassador. Eunice, you're very welcome. Would you like to unmute yourself?
Thank you. Thank you very much, Asmin. I'm Dr. Eunice Brookman-Amissah. Apart from having been an ambassador of Ghana to the Netherlands, I was also Minister of Health of Ghana in the late 90s. And one of the issues that I had to deal with at that time was the issue of health manpower. And I think that issue is a very important one that we need to look at. Health has become more than a patient, hospital, clinic, doctor issue. It's also a development and national economic issue. In fact, the motto of the Ghana Health Service is our health, our wealth. And more importantly, it has become a transnational also. So the traditional way of looking at health has to give way to a new paradigm. And it seems COVID-19 has thrown into clear view this wider dimension of health. And planning or projects in the future needs to recognize the new state of affairs. There's therefore a need for radical rethinking, for a new strategy for education and training for health services to respond to the needs of modern health delivery systems. Is the way we teach medicine and nursing, etc., still relevant today? And as COVID-19 has again shown, the world has become one global village with all that this implies for the spread of disease. We have artificial intelligence, telemedicine, and then the need for digitalization. Training for health delivery needs to keep pace with these new developments. Importantly, investments need to go into training of trainers starting from now. In most countries, medical schools are under the auspices of the Ministry of Education, which often are out of tune with the real needs of the health sector. We need to look at new ways of training to reduce costs, which could be prohibitive. Some have advocated for sub-regional centers of excellence for training for health, and also training health professionals for export. Also, multi-scaling offers greatest opportunities for cost benefit in our rural areas. In Africa, a lot of people live in the rural areas. We need to have people who would deliver for them, the services that they need, and when we don't have the numbers. And various cadres of health professionals are expected to work together as a team, but are hardly trained together. We need to consider colleges of health sciences where various cadres of the health delivery team train together with one philosophy and with one ethos so that they move together in unity. I think these are the few things that I'd like to bring to the discussion.
Thank you very much for sharing your insights on this. We have a few more people who will also like to come in, and I'm delighted to welcome into our webinar this afternoon Mary Robinson, the president of the Africa-Europe Foundation, who's also logged in with us this afternoon. Thank you for joining us, and I know this is an area of particular interest to you, looking at women's empowerment, hygiene, and other issues. So welcome, and you can come in at any time. We also have a few other people who would like to speak, Nina Rawal and Stefan. So shall we start with Nina and then Stefan? And Mary, whenever you'd like to speak, you're most welcome.
Hi, Tamsin and everyone. Thank you. I think I actually hadn't volunteered to speak, but I can't say no to the chance. So I'll just say briefly, thank you. I really look forward to reading the report. And my comment was around just trying to understand. I mean, it's an interesting move now when we see that the whole push for kind of local vaccine production and encouraging, speaking to the point Zeinab Badawi made around, the R&D capacity that is already there on the African continent, but that we should, try to push and support and accelerate in many ways. And that's why I just wanted to raise this point around kind of regulatory incentives, reducing the threshold or bringing new drugs to market by working with various regulatory incentives, like in the areas of rare diseases. And I think, if I'm not mistaken, in the area of Ebola and so on, just trying to see how can you, reduce the risk component of developing drugs for the diseases that heavily affect the African continent. So that was my thought.
Thank you, Nina. We do, I think, touch on regulatory issues in our report. And of course, the proposed establishment of the African Medicines Agency next year, once the 15th country has deposed its ratification of the treaty, would be a major step forward. Just as we've seen the African Centre Disease Control show extraordinary leadership in helping to develop a continent-wide response and to procure vaccines and a medical supplies platform, an African Medicines Agency would be a first step towards this regulatory convergence that would encourage in de-risk investment and development of medicines for the whole continent. Mary, can I invite you to come in?
Thank you very much.
Go ahead.
I actually hesitate because I missed a lot of the earlier part because I had to be on another Zoom. But as you rightly said, I am very both supportive and indeed urgently keen on everything you've been talking about and the need for Africa to have the manufacturing capability, to have the other capabilities, to have strengthened health systems, to have the health workers. But actually, the point I wanted to make links with the climate world. I'm going to be intensively at COP for the first 12 days, and indeed I go over on Sunday to Glasgow. And unless we have equitable access to vaccines, we're going to have such a divide in our world of countries which are very affected by COVID, very much more indebted than they were, and lack the vaccines that the rich world has helped itself to go forward on. And how can they go green? How can they, in other words, we cannot have a successful addressing the climate issue without also and urgently addressing the equitable access to vaccines, and below that, what you've been talking about, the strengthening in developing countries and developing parts of the world of health systems, manufacturing of, and all the equipment, the paraphernalia that goes with being able to address pandemics, but also to strengthen health systems across the board. So I just wanted to make the point, this is very linked to whether or not we will address the other crisis, the climate crisis, which is a very serious crisis. We're not still in a mindset of understanding this crisis, but very much part of it is equitable access urgently to vaccines. And I hope the G20 in Rome will get this point and will do what we have all been calling for. I've written to all the G20. Gordon Brown has been getting a whole lot of signatures to letters to the G20, specifically on this point of equitable access to vaccines. Thank you.
Thank you very much, Mary. And of course, as you say, all eyes are on Glasgow in the next few weeks to see what can actually be done. What we heard earlier in our conversation was that it's a great shame and a missed opportunity that access to COP26 is so limited for countries where they can't send delegations because of the financial barriers, the quarantine costs, and the lack of the vaccine inequity makes it hard for COP26 to be as inclusive as it should be. I note that in the chat, Angelica has mentioned that the African Medicines Agency will be formally launched on the 5th of November. So that's good to hear that we will have that institutional capacity to foster the development of medicines and to get that accelerated into Africa. Stefan, you've been very patient. Stefan Karakezi, your hand was up. Please go ahead. We can't hear you.
Not hear.
Yes, that's it. If you hold the microphone next to your mouth, we can hear you.
Okay.
Perfect.
I really had a couple of points related to the point raised earlier by Zeinab about African countries' contribution. Because a lot of emphasis has been on collaboration, which is correct. But I think the efforts of African countries also should be scaled up and looked at. And some very interesting development occurred during COVID-19. One was Senegal developing a low-cost COVID-19 diagnosis test, which could have been disseminated across the continent, and it's something we can all work on. The second one really was the special efforts that all governments did in providing water to low-income areas to help with washing hands and increasing the general hygiene of those communities. In Kenya, for example, there were initiatives that used solar water heaters and biogas to provide hot water in slum areas and solar energy, which has a very strong climatic component. And my feeling was that we should try and capture these initiatives and ensure that they are sustained over the long term, not just for COVID-19, but for general, for example, WASH initiatives, as well as other hygiene initiatives. And secondly, I think there was a great effort by African countries to get supply chains and local production of protective equipment, masks, gowns, and so on. And it would be a pity to lose that effort because we could maintain it because it will be needed anyway in the future for health systems, but also built up to deal with that. So those were my 2 points really, is what can we capture that was initiated by African governments in this COVID era and ensure that it is maintained for the future and helps to strengthen health systems. Thank you.
Thank you very much. And again, making some very valuable points for us to pick up on. We've got some elements that are coming up in the chat that might be worth addressing. So we've had some comments saying that, you know, we needed to, the report needs to highlight, and I think we've tried to do that, the issue of not just inequalities between continents, but also within countries, to make sure that marginalized communities or impoverished communities had access, that the distribution of the vaccine was done in an equitable way on the ground as well. Wuleta has put some information in the chat to say just how big the African health market is. It's a growing market. And so this isn't just a sort of humanitarian question to develop medicines and vaccines in Africa. It's a very strong business opportunity. There's an excellent business case for it. It's a growing pharmaceutical market. It's a young population who will also have health needs, and that things have moved on from that. I can see that we have further information in the chat, and we have a couple more people who've raised their hands. Michela Martini, you have raised your hand. Please go ahead. What would you like to share with us?
Thank you so much first for the invitation to have organized this high-level and interesting panel. I am a public health specialist based in Kenya, and for the International Organization for Migration, we cover the Eastern Horn of Africa. So this theme is of extreme importance for us. I have actually a follow-up from the previous speaker, and thank you to have mentioned the positive developments that also African countries, they have done during COVID. And I want to mention the great leadership of the African CDC and the current also dialogue they have established also to have a bilateral agreement with pharmaceutical company, so to have activated a parallel channel for COVAX. As we said, it was a big failure. We should admit that it's COVAX. So we are here still waiting for that solidarity platform. But the great achievement of many African countries in this regard. And as a follow-up also on the local manufacturing, because there's been a great efforts, and maybe it's the time also to reverse the narrative, in the sense, if we want African or European countries to help Africa, they can become buyer of these local manufacturing, instead of maybe to go to third continental area where to buy some products. So this can be also job employment and area that we can foster together. But my initial point where I asked to talk is there is an element that has not been addressed from the previous speakers, which is the human mobility and the migration in the context of preparedness of pandemic, but also in the context of global health. And especially in Africa, 80% of people, they move across borders. And when they move, they don't have their own rights to health to be recognized. There are still migration policy which hamper the access to services for many migrants, especially undocumented migrants. And when we are dealing also on climate change, this element is become even a further burden. Because as you know, migration is a coping attitude for climate change, but is also a social determinant of health. So there is the need also to enhance the health diplomacy also to influence migration policy in order also when people move, they have the right also to access the services. And my last point, a quick one, is on the need to reinforce strengthening the primary health care framework and approach, especially for the rural area. And this is imply the community engagement, the community event-based surveillance, and the role of the community, especially at cross-border. Thank you so much.
Thank you very much, Michela, for raising the issue of migration and that people move. And this I think has multiple elements, but you have mobility of health professionals, people moving, you have refugees and people who are fleeing conflicts. So there's large movements of people. And as you say, then there needs to be some thought that's given to access to healthcare and support to people who are moving, as well as the need, for training and education and recognition of qualifications. So there's an entire area there that needs to be addressed. I noticed in the chat we had a comment from Constanza Can from the European Investment Bank, and she's highlighted some of the investments that the EIB has made. What I noticed here is that it was supporting the COVID-19 vaccines, but the capacity that's being invested could also be used for malaria and tuberculosis, and indeed RNA vaccines are highly expected to be the new platform for vaccines and treatments against cancer. Constance, I don't know if there's anything else you can share with us, and perhaps just a little reflection on some of the challenges of domestic manufacturing, because just at the right at the beginning of the webinar, somebody put in the chat, can you honestly explain why it's so hard to set up domestic manufacturing in a continent with, we've got over 1 billion people, that's a large market. Why hasn't it happened? Now, Constance, I appreciate that you can give us some insight on the financing piece, but obviously you don't finance something unless you see all of the other elements in place. So can you just give us a short overview of, what are some of the challenges that need to be addressed before we can really get this moving?
There are indeed a number of challenges. Can you hear me?
Yes, I can.
Okay, yeah. And basically what I shared with you is the preparatory work that we are currently doing. Because before we can do an investment, we need to have a good, project. And that's why I think it is also so important that we're doing this in partnership with the European Commission, but also with several foundations and with a company that we have gotten to know quite well, during the whole COVID-19 pandemic, because we have been financing them to accelerate their research. And we are indeed currently discussing together with Rwanda and Senegal, basically all the preparations that we need to do in order to have, a good project that we can finance, that we can invest in. And it is an issue of bringing, different people together, realizing indeed that there is a big gap in vaccine manufacturing in Africa. But I would also like to take the opportunity to point out that there are a number of elements that are important. Health is linked to many other issues. And that's why we also, I think, need to look to the overall impact that the financing can bring, whether we do it on a specific climate project, on water projects, because if we don't get the whole picture right, as was mentioned before, we are still not going to achieve the impact that we need. But I think also your work has helped again to put the issue of local manufacturing really on the map.
Thank you for that. And let me perhaps just again ask you, within the foundation, we're reflecting on the need perhaps for health impact bonds, a bit like green bonds. So there would be specific financing that would allow countries to take out special financing mechanisms so that they could try to meet the Abuja commitments of investing 15% of their GDP, but it would allow them to front load that investment. I know that when the EU has just issued green bonds, and it was oversubscribed by 11 times, the largest amounts of green bonds in the world. So there's clearly an interest by investors in some kind of impact. Do you think it's an opportunity to develop new financial mechanisms specifically around investments in health capacity?
Yes, I absolutely think that there are opportunities. And again, it is also an area that we are looking into. We pioneered back in 2007 the Green Bond, the Climate Awareness Bond. And since several years now, we are looking into sustainability-linked bonds. But in order to be able to issue a bond, you need to be very clear as to what type of projects you're going to finance with that. And you have to make sure that you can convince, the investors that their money is really going to be used for what you say it is going to be used for. So you really need to develop a framework as to what it is then that you are going to finance in the health sector. And we have issued now sustainability-linked bonds for example, for water projects. And we are currently, my colleagues are working very hard to also review what we can do in the area of health and education.
Excellent. Thank you very much. And thank you for sharing the expertise from the European Investment Bank. We've got about 7 minutes left in our conversation, and I'm going to come back and invite both Gunilla and Zeinab to share some reflections on the conversations that we've had. Now, at the beginning, Zeinab, you said that, you know, we need both continents, the governments need to look at the extent to which they're meeting their commitments, you know, and African countries made commitments to invest a certain amount of their GDP in R&D, failed to meet them. But I should, to be fair, say that OECD countries, including the EU, promised to invest 3% of their GDP, and very few of them have met that commitment. So to be fair, this is a target that's more ambition than anywhere else. But we've just seen in the last 18 months quite why it's so important to invest in your research capacity and the life sciences in particular. So where do we stand in terms of both looking at the leadership from Africa and Europe and the extent to which you've got these big targets, governments often miss them? Should we let them go? Should we, as a foundation, be pushing for them? Where do you see that we are?
Yeah, thank you, Tamsin. I mean, I suppose the foundation has a very strong advocacy role, given that it's made up of Africans and Europeans, and then those who, like me, who straddle both worlds. I suppose the message is that there are things which the Africans must do to get their house in order, and there are things which the Europeans ought to do, and then there are things which the two can do together in concert. I still do feel, though, that you know, Africans, for me, it's important to sound you know, the message a lot louder to the Africans. We've seen what's happened in Sudan recently and so on. You know, governance is a huge issue, and African people have not got the governments that they deserve. So all of this is pie in the sky when you've got instability like that. But I just want to echo, I mean, I've been following the conversation. I think it's incredible. I agree with, you know, the things that are put in there. Björg Pálsdóttir from THEnet has just sent a message, and I totally agree with him. It reinforces what I want to say. He says it's important to invest in academic institutions and innovators in Africa so that they lead research and development, data collection and analysis. And that's what I meant by you drill down and look at the funding mechanisms for these so-called partnerships and collaborations, and you find that actually it's the European institutions and scientists who are the primary recipients of these funds with African partners. So I think we should be investing much more into institutions and companies. So we really need to have a gimlet eye when you know, we are talking about these initiatives and partnerships. And I think the role of the foundation is to ensure that it's not what we just see on the surface, the veneer, but actually what's drilled down and see what's going on. But I think at the end of the day, the greater onus is on the Africans to rely on themselves to do what they need to do with the support of the Europeans if it's coming. But I have to say that the vaccine debacle has really shown that, you know, the jury's out on whether that's really coming, because, you know, we know what the figures are. And so I think that perhaps it's been a wake-up call. The short-term picture is quite dismal, I think, in terms of the partnership, but we can do better.
Thank you, Zeinab. Gunilla, can I bring you in to reflect on some of the things that you heard? We spoke at the beginning about some of the governance mechanisms, and that this is a window of time. It's a moment to press reset, and there's lots of openings to re-explore how governance mechanisms work. We've got some recommendations in our report, but there is this next window of time, which will be COP26, to see whether global collaboration can actually meet the challenges that are in front of it. What would you like to leave us with as a final message?
Thank you, and thanks for all great interventions and for participation. I really sense that there is a lot of, in one way, realism about where we are today, but at the same time, some kind of optimism, because we can't continue as we've done. We can't find new solutions on old thinking. And when we now are talking about European and African working together, I think it's very important to recognize our shared values and that we need institutions that can help us to bring us together and to develop solutions at the same time. But we have also heard now about the interlinkages and so many things that needs to be sorted out. Health is also access to water, sanitation, and jobs. So I also would like to see that we are more clear in the European Union, together with Africans, on how we can leverage partnerships with distinct ambitions. Because if we try to do everything at the same time, it will be more of the same. And we would like to see more of solutions now. And that's why I hope that we could have smarter partnerships addressing different things at different times, but with really distinct topics. And you could argue that COP26 is a big partnership, but in order to make it work and to be implemented, we're going to need a lot of collaboration between science, businesses, youth, communities, and hence I hope that we can have a new era, not only with the big multilateral institutions, but equally also strong and well-functioning, distinct targeted partnerships. And for that, we will need not only finance and capital, we would also need this kind of engagement that I do find in the foundation and also among those that has participated today. So hence my optimism, and also thanking you so much, Tamsin, for moderating us so well.
Thank you very much, Gunilla. And a couple of people have asked in the chat where they would find the report. We posted the report in the chat. And for those of you watching on the live stream, you will find our report. It's just been published on our website, the Africa Europe Foundation. You'll find links in social media. I'd just like to conclude where we are, to say that the last 2 years have really brought home to us in two ways, both in the climate and from a health perspective, that we are totally connected and we have a shared vulnerability. One of the big messages that you've seen from COVID-19 that's been recognized at WHO level and heads of state is the importance of data. You can't make good decisions if you don't know what the situation is that's happening. Where is the data collection? It happens at local level. So the lesson that's come through very clearly is we must strengthen the local community level, whether it's surveillance, it's public health, but it's also social resilience, it's better housing and the determinants that make sure that our populations will be more resilient both to future and emerging health threats, but also to climate change. So I hope that the message has come through of the importance to connect senior political decision-making, heads of state, and what's happening at communities on the ground, because if that connection doesn't work, then we are all vulnerable. And in order to overcome and survive through the challenges of climate change, where we're seeing accelerated impact across the world, whether it's flooding, it's extreme heat, it's extreme weather events, it's new diseases, we're all experiencing one way or another, and those impacts will accelerate. To find the solutions, we have to collaborate, and that means using the best minds from wherever they are, whether they're in Europe or Africa or elsewhere. So we need an investment in education and the infrastructure to make that happen. Thank you all for participating, and we're delighted that so many of you engaged very actively in the chat and participated. As we said, this is part of the Talking Africa Europe series of debates. So every month you'll have an activity like this on a topic and an opportunity for you to share your views. Please download our report, look at the recommendations, and we will certainly, for the Africa Europe Foundation, be taking it forward. We have a presence at COP26 with the South African Pavilion, and we'll be passing the messages. We are also working for the preparation of the Africa EU Summit, which will be held in February next year and beyond. We want these recommendations to arrive at the right place, and we want policymakers to listen, and we rely on you to help amplify the messages. Thank you all for participating, and see you again soon. Goodbye from our studio in Brussels.